St. Nicholas Hospital has been in existence for the past 54 years. We were set up by Chief Dr. Adekoyejo Majekodunmi when he left his position as the Minister of Health of Nigeria over 54 years ago.
He initially came back to Nigeria in the 40s and went to work in Calabar and found that a lot of the pregnant women were not getting good antenatal care, so the outcomes for the babies were bad. He then went back to Ireland and studied obstetrics and gynecology, and he came back to Nigeria.
And since then, we've tried to maintain that quality and safety standard. As our mission statement says, we are set up to serve the healthcare needs of our community, and we propose to provide comprehensive care, which is primary, secondary, and tertiary care, and in the process to prevent illness, relieve suffering, restore health, and promote well-being. And we propose to do this during every stage of life, from conception to the geriatric patients. We provide it using advanced procedures and modern technology, and also within our available resources in a focused, caring, compassionate way that focuses on the safety of our patients in providing that care.
I do not think we should provide any service here, or anybody should have a service here that I will not be able to use myself. So if my wife wants to have a baby, she should have a baby here. If my children want to have care, they should be able to have it here. So the care that we give to everybody and anybody, no matter the person's social status, should be of a certain quality, and the quality that is good enough for me. If it's not good enough for me, then I don't think it's good enough for them. So we've done this accreditation. We have a quality department that looks at what we do, but basically is that the quality of care should be, if it's good enough for them, then it should be good enough for me.
And that has been our mission and our vision since we started off several years ago. We have been noted for providing quality care, but more recently, we have now focused on several other things. We have expanded our services, and contrary to what happened 30 years ago, we've now expanded and now have branches in Victoria Island, which is basically a clinic. We have a branch at the Lekki Free Zone, which is an industrial clinic for now. We have another hospital at Maryland, the St. Nicholas Hospital at Maryland, which also provides both outpatient and inpatient care. And the latest addition to the services that we render, of course, is the St. Nicholas Hospital at Surulere, which would also provide primary and secondary care and offers both outpatient and inpatient care for our clients living in the vicinity of Surulere.
Patient safety is key, and we've looked after the St. Nicholas family. St. Nicholas staff are like family, so we've had people who've worked here and now their children work here. We've had people who've been with us for over 35 years and still love it.
My name is Osaji Stella. I had operations here at St. Nicholas Hospital and the lab also. I've been here 24 years running now, and I can tell you it's been an awesome experience and quite a journey too. I remember when we first started out here at the lab, we didn't have all of this equipment in place, and we've transitioned to where we are right now, currently employing the state-of-the-art equipment that we have, be it chemistry, be it microbiology or hematology. We're open 24/7, so at any point in time you walk in, you'll be sure to have a scientist on ground to attend to your needs, and our turnaround time are quite enviable. I say enviable because I know that we surpass all of what is happening in our environment. So yes, we should be your first choice and only choice if possible, because we guarantee that you get excellent delivery of services from the laboratory.
My name is Bolanle Kolajo. I'm the Chief Nursing Officer at St. Nicholas Hospital. The position that I held in the last 7 months. I started my nursing career in St. Nicholas Hospital way back in the 80s. And after that, I relocated to UK. Because excellence thrives in St. Nicholas Hospital, I had to come back to give back to my community.
My name is Ibeju Lekki. I'm a nurse. I've been here in St. Nicholas Hospital practicing nursing since 2009, that's 13 years ago. Nursing practice in St. Nicholas Hospital is an evolving trend. We work with state-of-the-art equipment. We manage our patients conscientiously and with the latest technological equipment, as I said earlier.
We've also focused a lot on improving the quality of care that we provide. And quite recently, as would have been evident in the news, we were accredited by the COHSASA, that's the Council of Health Services Accreditation. Our hospital was accredited and certified fit to provide services at international standard. And that is one of the main things that one feels particularly proud of, as not many private or public hospitals currently in Nigeria have that accreditation in place. We've also recently focused on training, and we have subsisting accreditation to train intern house officers or medical doctors for their first year of practice after their medical student days. And we've done this now for well over 30 years, and probably one of the very first private hospitals accredited to do so, and one of the only ones that has consistently sustained that accreditation and have trained hundreds of medical officers over the years.
My name is Angela Botoku. I'm a medical student and I'm currently having summer practice or an internship at the St. Nicholas Hospital. So far, I've been only here for about 2 weeks and it's been such an amazing experience. I've learned so much. I've met with so many intelligent doctors and amazing healthcare officials, and I find it very interesting that even after 50 years, over 50 years of existence, this hospital still operates with 21st century healthcare, is up to standard, and you're assured of the best healthcare in St. Nicholas Hospital.
At the beginning, that is the beginning of St. Nicholas, we were known mainly as a pediatric and O&G, that's a women and children's hospital. If you look at our logo, you can see the emblem or the logo is a woman carrying a child. So it was a mother and child hospital. We've kept that strength of having mother and child, but there are a lot more hospitals and clinics that have opened that serve that. We always try to be relevant. I'm sure everyone knows about St. Nicholas and our kidney transplant program. We have, I can easily say, one of the best dialysis centers there are in Lagos and maybe in Nigeria. And we do a lot of kidney transplants.
More recently also, we were accredited and became the first ever private hospital given accreditation to train intern nurses. The training of nurses has recently shifted to university training, where they're now required, like the medical house officers, to do 1 year of internship. And we became the very first private hospital granted that accreditation to carry out that training, and we've done so successfully for 2 cycles now.
We pioneer so many programs in Nigeria. In St. Nicholas Hospital, we are the only private hospital who has been accredited to pioneer the nursing internship, and this we have had positive feedback about since we started. We are looking at enlarging this process of this internship to accommodate the NYNC, so that after their NYNC, we can bring them to St. Nicholas Hospital to continue the excellence nursing care.
Nursing care in St. Nicholas Hospital is commendable because we are strong on infection control, and that I cannot compromise. That's why I still, love to work with St. Nicholas Hospital.
Our intensive care facility has also always been there. We are one of the very first private hospitals that provide such critical care to our clients. And we have various levels of that care, from the critical care unit to the high dependency unit and to the step down unit, all with successful outcomes.
We will continue to ensure primary and secondary care, that's from vaccinations to open heart surgery, can be got here. We will still ensure that we look after our community. We do some free healthcare projects. We'll continue with that, and we'll continue to look after our staff.
We take small steps in the right direction. So we'll continue to take small steps, and sometimes if we have the opportunity, we'll take a big step. We'll generally take small steps, but in the right direction. I think that's very important, because you can, if you stand still or you don't do the right thing, you tend to fall back. So you need to take the right decisions and keep doing it.
We're proud of our legacy, of the legacy that we've inherited from the founder of the hospital. We miss him dearly. It's 10 years this year that he passed on. And we hope that wherever he is, he will look down with happiness that we have been able to sustain that legacy that he bequeathed to us.
So in the future, I see us continue to do what we were doing. Maybe opening of some more branches, I don't know. Was one of the things that my father always said, was that we shouldn't expand more than where we are now, because it's so difficult to manage multiple locations, and it's true. I found that to be very true. We've expanded more. We now have 5 locations, and it's a job to keep them all at the same standard as the main one. But we're making good progress. We'll succeed. So in the future, I see us staying where we are. So we've managed to stay in the relevant group of hospitals for the past 50 years. So in the future, I see us also staying within the relevant group of hospitals in the country.
My name is Dr. Ebubangwe. I'm the clinical director here at St. Nicholas Hospital.
My name is Delise Claudenin. I am currently the general manager of St. Nicholas Hospital, or you could say the chief administrative officer.
Dr. Adekoyejo Majekodunmi. I'm the MD, medical director and CEO of St. Nicholas Hospital.